What are you waiting for? Today, we want to talk about something that has been so normalized in medicine that most of us don't even realize we're doing it. Waiting. We're trained to wait, praised for waiting, told it's part of being a good doctor. We delay our needs, our dreams, and sometimes even our whole lives, put them on hold. Today, we're going to explore how waiting shows up in our careers in medicine, how it serves the system, and what becomes possible when we stop waiting. Thanks for joining us today at the Healing Medicine Podcast. Who are you listening to? I am Dr. Jessie Mahoney, and my co-host is Dr. Ni-Cheng Liang. We are two board-certified physicians who bring decades of experience to the conversation about wellness. If you crave more ease and aspire to rediscover your love for medicine and life, one mindful step at a time, you are in the right place. We hope you'll love today's episode, and if so, please share it. A reminder that nothing in our podcast is medical advice. Today's episode is about waiting everywhere, and we'll start off by waiting in training. We are taught early on that we have to delay life until after training. It's a virtue. Endurance is professionalism, and sacrificing our needs means we're committed. During training, we wait for food, for sleep, for recognition. We wait for someone to tell us when we're done, when we can go home. We wait because we're told it's temporary, that we will get to stop waiting when we're done. It's a necessary thing, waiting. It's just part of becoming a real doctor.
We waited for lab results. For those of us still in clinical medicine, we still wait for results. And then in training, of course, and as an attending, we would rightfully wait for the post-procedure film to make sure that there wasn't a complication, like a pneumothorax after a thoracentesis or post-central line placement, or like the studies on the pleural fluid to make sure it wasn't like an empyema. And as a result of all of that waiting, cumulatively, because there was like probably some waiting that definitely I didn't need to wait for, I postponed my own health, my own doctor's appointments, dental cleanings even. And then on rounds, we waited for our attendings. We waited for the rest of the team to show up. We also waited a long time to actually make living salaries after years of postgraduate training, making like 50 cents an hour. And many delayed marriages, including me. I myself had a 3-year-long engagement. It was like practically as long as my relationship before the engagement. And the reason why I did was so I could comfortably be in training before my wedding. And I did actually postpone kids until after residency, which was a very personal choice for me. But had I not been in residency, I definitely would have had kids sooner, I think. And then I also remember in residency, there were 4 code blues back to back to back to back on call, either cardiac or respiratory arrests, all within the span of 2 hours. It seemed like we were just running from one code to the other. And each one is basically a signal that someone is dying or has already died. And it's all very jarring to be involved, especially if you were part of the code team or the code leader, which a lot of the time I was. And in doing so, I had to wait to feel all of the emotions about each code so that I could move on to the next code or move on to admitting the next patient with a clear mind to do my best for the next task that I needed to do. And just normalizing the fact that that is not a normal human experience. To have the task of trying to save another human being who has died or nearly died and trying to bring them back either from death or the brink of death, and then not have the time and space to process that experience. So like I even waited to feel. And now, gosh, decades later, finally, debriefs after code blues are much more routine. Apparently now they could potentially be named hot debriefs, so immediately after the code, versus cold debriefs, which is more of like an aggregate mortality morbidity type conference that's much more systematic and scheduled. And so looking back, how I would have benefited from both types of debrief.
And when residency ends, we actually don't stop waiting. We are then told to wait for the system to get better. We have to wait for adequate staffing. We have to wait for admin help. We have to wait for manageable schedules. We have to wait for insurance things to change. We have to wait for the system to notice and fix things. At meetings, we wait for whatever we decide at a meeting to happen. We're on task force and we make decisions and then we wait for them to change. And all the while, we keep telling ourselves that if we wait long enough, things will happen. And I'm going to just throw out here, I am terrible at waiting. I don't like waiting. And most of us in healthcare have an urgency bias. So we don't like patients and we don't like waiting. So one of the stories that I used to tell myself in my organization was that they would do the things that I thought should be done now, 3 to 5 years. And that was about the right time course. That's how long it takes in a big organization. It's not a purposeful thing that they don't want to make change, but healthcare organizations are like big tanker ships or container ships. And it just takes a while for them to turn. It takes a while for things to happen. I used to think that story was useful because it got me to relax while waiting. And it wasn't that we were out of alignment. We were simply on a different time course. And we've talked about that here. But what I realized when I started thinking about this whole waiting thing is that it was really a strategy so that I could wait more comfortably and be accepting of what was in the moment. And that is helpful and also not. How's that?
I love that analogy. So I'm going to take that analogy a bit further. So like I envision myself like 10 years ago on that big tanker ship, waiting for the turn, waiting for us to either speed up or slow down. And I decided I couldn't wait any longer for that turn to happen. And so I basically literally jumped ship and I got myself on a little small I wouldn't say dinghy, maybe a medium-sized yacht, not a tanker ship, that can make turns much more acutely, can slow down and speed up without too much extra need for momentum or gas, much more nimbly. But then I'm still kind of loosely attached to like a big tanker ship, and I feel much more in alignment with the same speed in which the yacht needs and potentially could turn at.
Yeah, I love it.
So going back to when I was a young attending, I waited to take vacations.
And notice we wait through residency to take time off, right?
Right.
Take vacation. And then I want to point out you finished the training. They told us when we got to the end, we would get a vacation. But no, then you have to wait to take vacation. You have to wait for your turn to have a holiday off.
So after I left my first position, I had hundreds of hours of vacation that I had accrued and not used. And so since then,
Can I ask you why? Did you not use it?
There was definitely a guilt component of like not wanting to leave my patients or making my colleagues cover me while I was gone. I think that was a lot of it. Also, there was this need to kind of prove myself as a junior attending that I was this like very reliable, dependable hard worker that was always there. But I think definitely to the detriment of my health.
Yep.
Right.
Tell us about that.
Well, yeah. And then, so even into my cancer journey, there was more waiting. Like I waited 5 years after my cancer diagnosis, which was a more comfortable amount of time to ensure the cancer hadn't come back before having to try to have kids again. So number two. And by the time that happened, I was already considered advanced maternal age, which I think is a really derogatory term. And I wish they would go away with that terminology. And I was already doubly high risk because of that, plus the cancer diagnosis. So I was like extra, extra high risk. And now as an attending, even though I'm now taking my vacations and I've made it such that my day-to-day schedule and my work week is much more compressed so that I don't have to quote unquote take long vacations multiple times a year. I now have a compressed clinic week such that I have like longer weekends in general. I'm still waiting. Like I'm waiting for insurance companies to approve my patient's new medication that they really, really need, or apply for patient assistance where the drug company can cover the vast majority of the cost, or waiting on durable medical equipment companies for patients who need home oxygen, or even just the results of an imaging exam. Ultimately, we delay a lot. Joy, rest, vacations, even emotions. We delay relationships. We delay having aspects of our family expand. We ultimately delay so many huge decisions that affect our lives so deeply. And I think a lot of it is because we're ingrained to do so, that there will be some magical time in the future where it's going to be just the right time, not now, but later. And while we're waiting, we keep functioning, we keep overfunctioning, we keep taking on more and more responsibility. We are doing all the things, coordinating care at home, work, covering gaps when colleagues are gone from the clinic or in the hospital, and then doing the invisible work of being like, oh, well, yes, I am the only clinician in clinic today. So yeah, I'll fill this other patient's prescription that I don't see, but really needs this inhaler. And ultimately not getting compensated for it. And all at the same time, like holding some semblance of composure. And not because the system is supporting us, but ultimately because as healthcare professionals, we are caring, empathetic human beings. And perhaps there is some semblance of hope underneath this composure that maybe one day we'll finally get acknowledged for all of the extra unpaid work that we do. Maybe one day the compensation will come. Maybe one day the exhale and the rest will come.
And my invitation here is that maybe they're not coming. If we are continuing to wait and continuing to overfunction while we wait, this is actually working well for the system. And we sometimes say, well, the waiting is a result of the system being broken. It's a hiring problem. It's a systems problem. And I want to discuss for a moment, what if it's actually designed this way? What if it's functioning by having us being willing to wait? And so this realization that's pretty painful is that maybe this system isn't actually broken in the ways that we think it is. What if it's depending on our waiting and our patience and our silence and our willingness to fill the gaps, self-sacrifice, do the right thing? Our willingness to wait and defer is preserving the structure of the system, and that is keeping things going. Not for us, but it's keeping the system going. And what comes to mind here is that I already told you I was a bad waiter, and I had a child. I didn't wait for training to end to have a child. I had a child during med school and a child during residency. And The system is not designed for that. And so when people don't wait in the way that the system wants us to, and the system is not designed, the system begins to break when people begin to say, well, actually, I'm going to do it this way. The system is literally designed for us to wait. And so what has been happening more and more, the system is not designed for women. We're waiting for it to catch up to the fact that every woman physician in it is of childbearing age. That this waiting is allowing the structure to stay the way it is. And that part of the reason things are shifting now is that many people are saying, like, wait a minute, I can't wait my whole life to take a vacation. I can wait my whole life to spend time with my kids. Both are possible and important.
So the healthcare system's failure is oftentimes blamed on leadership, the lack of enough staffing and resources, insurance companies, but it also goes deeper. The current US healthcare system is also sustained by us as physicians because there's a lot of enduring quietly. And part of that is because we were indoctrinated, ingrained in our training to do so. We were taught in an environment that this is just the way it is. And maybe we could be afraid of what happens if we don't accept the status quo. What happens if we don't comply?
And both of us didn't comply at some point. We decided to stop waiting, right? And to instead start living and stop waiting. And many of the people that I work with as a coach are waiting for someone to give them permission to go practice differently or practice in a way that's in alignment or work part-time and this isn't to get out of medicine. It's literally to stop waiting for someone else to fix it and to start making it work for you in a way that actually, when things work for us, we're able to contribute so much more. But we are afraid. And I would say that many of us keep waiting because of a fear of what will happen if we stop waiting. And my shift was filled with just honestly terror when I stopped waiting because it's so uncomfortable. And there's a fear of what other people will think. There's a fear of failure when you stop waiting. When you step out of line of this expectation of you'll just wait for other people to fix it and you'll be willing to wait forever. And so when you make this shift, I just want to point out there's a lot of fear. And I see this in so many people. And so are you waiting because you're afraid? Are you waiting for someone to give you permission?
For me, I had to stop waiting to enable myself to stay in medicine. From my cancer journey, coming back to pulmonary fellowship and deciding I wouldn't finish critical care fellowship for my own health. Because I became an integrative medicine patient as a cancer patient, I knew ultimately I wanted to do the integrative medicine fellowship with the University of Arizona. But I waited because I wanted to become more proficient in pulmonary medicine as an attending first, and then delayed pursuing that integrative medicine fellowship. But when my first attending position as a medical director started becoming more and more out of alignment with my values, I also then waited even longer until after I had my after diagnosis baby, my AD baby, who's now my youngest, to leave that big oil tanker. And I was petrified to leave a system, the only system that really I had known for, at that point, decades, and enter a brand new system where many people didn't know me in the old place. Like, people knew me from years and years of me being there. And so in the new work environment, the pace of work was way faster. It was more condensed, but it also provided the opportunity for more space, more time away from clinical medicine during the week, and the ability to pursue these outside interests like teaching and practicing mindfulness, giving talks, being present for my kids in a way that my parents weren't available to me. Ultimately, a healing journey for myself and reparenting myself, which is ongoing. And so I think both you and I, Jessie, like took this leap of faith in moving to different positions, partly into the unknown and creating as we were going our own paths. And I was finally able to enroll in integrative medicine fellowship and graduated in 2022. And honestly, going through that fellowship felt like coming home. Like it was such an exhale. It was such a like this is the way medicine should be practiced. And I'm so, so, so grateful to incorporate the knowledge and wisdom from that fellowship into the way that I practice medicine now.
And I don't think I've shared this on this podcast, but I also almost did the integrative medicine fellowship, and I applied and was accepted. But I waited to apply for about 2 or 3 years because I thought that it just was too indulgent and I should be spending my time doing something else. Then I was accepted, and then I deferred for several more years, like as long as they would let me defer. Ultimately, I ended up not doing it because I had literally stopped practicing clinical medicine. And had I done it in the beginning, I might not have, would be my thought, right? Like, would I have found a way to integrate it into what I was doing, or would I have pivoted to something that I could have integrated it? So sometimes we're waiting for something. I was waiting for someone to tell me it was okay, or that I could spend time on that when I had 3 children. Like, I just was waiting. And sometimes we wait so long, we don't even do it. And I would just ask the question again, what are you waiting for? What was I waiting for? I don't even know what I was waiting for. I was just waiting. I was very good at waiting, even though I don't like it. I've gotten much better at it. And so it's sort of, we just wait. We wait until they fill the open position, and we fill it up while we wait. So I want to point out that you and I are not the only examples of people who have stopped waiting. Many people who I work with, once they make this realization, they're like, wow, what am I waiting for? We're waiting for the right time, or we're waiting for when we, feel confident, and we're probably not going to feel that way. And I was a bit inspired as we were talking about this podcast to share the story of someone I worked with. And we did coaching maybe a year ago, a little more than a year ago. And then this amazing woman physician finished her coaching, and I heard nothing from her. And very recently, she shared with me that in the time since her coaching, it's been about 9 months, she moved practices, bought a house, got married, got pregnant. It's like, wait a minute, like, all of these things happened. And it was once she gave herself permission, she knew all the things she wanted to do. She's practicing in a different setting, and she had all of these things that she's just been waiting for the right time. And part of it is we're waiting until we finish training. We're waiting until we're no longer a new attending. We're waiting for things to get better. And when we decide to take action, we can use that overfunctioning that you talked about at the beginning as an asset, because we are some people who can make change really fast once we decide. And once we lean into what we already know is really important to us. And so for those of you who think, wow, I can't do it, I just want to point out that you can do it. It's literally a decision to decide to stop waiting and to start doing those things that are important to you, because it's really just a matter of making the decision. And I'm really looking forward to hearing what all of you do, because when that light bulb goes off and you give yourself permission, you can do amazing things.
Oftentimes we think we're waiting for change, but not change that we necessarily choose. We're waiting for change that might come from external sources, waiting for the system to change, waiting for that committee to make some well-being changes on behalf of the entirety of the system. It might feel altruistic, self-sacrificing. You might even acquire some more accolades, like some sort of martyrdom in waiting. But really, what we're waiting for is permission and also wanting to give ourselves permission, which we can actually grant ourselves today. Now, we can choose ourselves. So when that shift happens from waiting to choosing ourselves, everything can realign for the better.
Waiting might feel like loyalty, but over time, at some point, it becomes quiet resignation. Waiting costs energy. It can cost our presence. It can cost joy, delight. It can slowly erode who you are if you are waiting for permission to do the things that make you come alive.
And so we invite you to ask yourself, where are you still waiting?
What is waiting costing you?
What are you postponing?
What might shift if you stop waiting? What are you
waiting for?
So don't wait to coach if you feel like it's something that would help you. I hear from so many people that they're waiting for the right time or waiting for there to be more space or waiting for permission. And I waited myself for several years. And my only regret in this journey is literally the several years that I waited. I was waiting for someone to say, yes, you should do this, or to tell me that it was okay to get help. And so I encourage you to lean into what feels right to you and stop just waiting for someone. Give yourself permission to do the things that you want to do, whether it's that or something else. I hear from many people as I am rolling out my spring group coaching programs, I'm going to wait till the fall, or I'm going to do it in January 2027. And that's fine. Feel free. And I just want to ask, what are you waiting for? If you don't start now, these programs all start in January, end of January, early February. You have to wait till August. I don't do them that often. Or you'll have to wait longer. A lot of people say, oh, I'll just start next month. But remember, what are you waiting for? And you can start next month. The other thing I hear from people all the time is they're waiting to do a retreat. They're gonna, it's on my bucket list. And I'm like, okay, well, what will it take to do your bucket list? I'm going to digress for a moment because I heard this amazing story. I have been going to this amazing storytelling in the redwoods, and they do it outside at night, even in the winter. And this guy, who's a great storyteller, told a story about his son. And his son said he wanted to do one thing on his bucket list for his birthday, and he was 14. And so the dad looked at the bucket list, which was, ride a horse, go on a jet ski, and go on a kayak, or like whitewater kayaking. And the dad said, we're going to do all these things in one day. And he got a friend, and he got the friend's dad. It was just a wonderful story because these storytellers are really exceptional storytellers. And the kid said at the end of the day, and these were kids who were apparently not very outdoorsy and just more computer types who didn't really do outdoorsy things. And all these things were outdoorsy things. And at the end of the day, they said, that was the best day of my life.
Wow.
And I think it took some doing to do it all, but to imagine that, why wait for the best day of your life? When you can make things happen, because you just never know what will happen. It really inspired me to think about, number one, what are the best days of my life? We should do a podcast on this topic. And what are you waiting for? If there's something on your bucket list that you could go do this weekend, because sometimes they're not big things, make them happen. Stop waiting. We somehow think it's glorified to wait. We're better if we wait. And I would say, since most of us are not super patient people, don't wait for the thing that's going to light you up or make you happy. My other invitation is don't wait for the end of the year to use your CME. Every December, I have this rush of people that didn't use it and didn't plan ahead. And what are you waiting for? You're waiting to figure it out later. What if you put yourself first?
So on that note, don't wait to join us on a retreat to practice everything that we just talked about in real life with the benefit of optimized physiology, which can only happen when we are in nature. So please join us at the Connect in Nature retreat. It's back by popular demand to rejuvenate, connect, and reconnect with yourself and others, your friend or partner, in a garden, at the beach, amongst the redwoods, all in nature. Our Bring a Friend discount doesn't expire, but don't wait, because as of opening registration, we're nearing the halfway point and those spots are going. And in the past, we have sold out of this retreat in prior years. So we invite you to give yourself permission and not wait to join us.
And I do want to point out that some people in 2024 were waiting till 2025 when we didn't have the retreat. And they ended up having to wait 2 years, which I think is in part where some of those spots came from. Many of the spots that are filled with people who are coming back. And to me, that says you should come now, because otherwise, you're just waiting for something that you want to do. And if people are coming back, you're going to want to come back. So get started now. So with that, stop waiting, start doing the things that make you happy. Do something on your bucket list, join us for a retreat. Notice where in your life you're waiting. Is there something in your life that you've wanted to change that you haven't changed? Something that you want to do that you haven't done? Are other people benefiting from your waiting? Are you just exceptionally trained to wait? And consider what might happen if you stop waiting. Thank you all so much for listening. Please don't wait to share this podcast with a friend who might benefit. And please don't wait to leave us a written review. We would super appreciate it. We won't wait to ask you for that favor in the future. And we would love to have you and many more folks join us. We'll see you next week.
Thanks for listening. If our message resonates, we'd love to connect further. Join us for coaching, mindfulness experiences, workshops, and retreats. Invite us to speak at your institution or conference. When you work with us, you don't just consume information, you create real change. Find me, Chang Liang, at Awakened Breath and Jessie Mahoney at Pause and Presence. Welcome to this mindful moment offering. This is a practice that might be a bit more uncomfortable or difficult for you, but I invite you to get curious about it and see what arises. So if it's safe for you to do so, going ahead and closing your eyes or lowering your gaze a few inches in front of you and recounting an event where there was some discomfort that arose in your practice of medicine. Maybe not the most distressing event that you've ever been part of or witnessed, but something that's mildly uncomfortable. And as you're bringing that forth into your mind's eye, this somewhat uncomfortable recollection, inviting you to notice the body sensations as you're recounting the difficulty. Noticing if there's any areas of tension or unrest, fluttering, even sweat. What's happening in the body during this recounting of a difficult moment in your life? And next, inviting you to name the emotions that you're arising within. we spoke about feeling to heal. And so knowing that feeling these uncomfortable emotions that might be arising is part of moving through, a part of a healing process. So naming those emotions, whatever's present for you here right now, is part of your lived experience and truth. And next, inviting you to notice the thoughts that you're having about this somewhat uncomfortable recollection. Noticing judgments, storylines, emotionally charged thoughts or stories, and seeing if you can notice them just as they are, not judging them, bringing a sense of warmth and compassion, of holding these thoughts just as they are. Recognizing that thoughts are nothing more than chemical reactions in the brain between some cells, and that they don't have to be your reality. They don't even have to be true. So, can you notice these thoughts that are arising for you as if they're clouds passing through the sky or leaves drifting down a stream, simply acknowledging their presence just as they are? And now coming back to this moment for yourself, perhaps grounding into this moment by noticing the sensations of your feet, the sensation of breathing at the nostrils, grounding into this felt lived experience within this body right now. And having gone through that circle of awareness, noticing if there's been any sort of shift in how you feel now compared to just a few minutes ago before this structured circle of awareness mindfulness exercise. Thanks so much for practicing with me today. And you can open your eyes if you haven't already done so.